There is growing recognition the age-based vaccination strategy needs to be modified now to include younger essential workers. As Abigail Bimman reports, the federal government is also under intense pressure to get more vaccines into the country faster.
It was the Prime Minister's first address in a week that saw climbing COVID-19 cases and an 18% increase of people in ICUs.
COVID-19 isn't done with us yet, and that means we all have to hold tight a little longer.
Justin Trudeau said he's speaking to Ontario Premier Doug Ford Tuesday and all premiers Wednesday.
And if anyone needs extra help, the federal government will be there.
Facing criticism over Canada's bleak vaccination rate, his health minister tweeted a thread showing 10 million vaccines have been delivered nationally. 35% sit in freezers, 1.5 million of those in Ontario.
We just got those. We literally got them a few days ago.
Questioned repeatedly, Patty Hajdu refused to say if she felt the rollout was too slow, stressing she was just trying to provide clear facts.
We've heard all along that it's confusing, that numbers are, flying out of a variety of different sources.
And you can prevent more deaths and more hospitalizations and more infections by focusing on and prioritizing those people who are at risk of exposure.
As vaccination rates inch up, there's concern essential workers aren't getting them fast enough.
By the end of the week, those aged 40 to 59 who are frontline workers who are interacting in person with the public and who cannot work virtually will be able to start booking their appointments.
BC had a plan to prioritize essential workers, now forced to retool after the advice not to give the AstraZeneca vaccine to those under 55. The biggest problem is still in Ontario. Dr. Zane Chagla says the infection rate is 2.5 times higher in some neighborhoods there, home to more essential workers.
Uncontrolled community transmission is leading to hospitalizations, is leading to scarce ICU resources, is really leading to that healthcare apocalypse that we thought was going to happen at the very beginning of this pandemic.
A year later, in round 3, the alarm bells keep ringing. Abigail Bimman, Global News, Ottawa.